Acting as a caregiver for a loved one suffering from dementia can have a huge impact on both parties.
Joining us today to share insight and important information are Paul Campbell, who is the CEO and co-founder of Moneta Health, and brain health educator and author Hartley. Good morning.
Good morning.
Thank you.
Yes, of course. Well, Paul, you were here with us last month. Can you just remind everyone what Moneta Health is and does for our community?
Yeah, I'm excited to be back. So Moneta, we're a brain health company, and our mission is to change the way that we care for our brains, especially those who are experiencing cognitive challenges. So what we did to deliver on this mission is we've built a cognitive rehabilitation program that's delivered at home. So cognitive rehab is like physical therapy for the brain. But when we built the program, we designed it not only for the individual with the cognitive challenges, but also to support the needs of people like my friend and colleague Kat, who are on the front lines of delivering care.
Yeah, Kat, we mentioned that you're a brain health educator and author, but on top of that, your family is also, unfortunately, I'm sorry to say, that been touched deeply by Alzheimer's disease. What does it mean to be a care partner in terms of from your professional standpoint and actually doing it yourself?
Right, that's a good nuance. So stepping into the role of a caregiver, there is a lot of compassion, but there can be a lot of overgive and exhaustion trying to maintain and take care of everything for someone. So I love to think of it as a shift, that you're a partner now with someone, and it is changing. And we want to elevate that person who's experiencing dementia, foster their independence, maintain their dignity. But the key is, we caregivers, we need help. And we need support from family, friends, community, and programs. And I find that it's really hard sometimes for people in a caregiving role to actually ask for help.
Why is that, do you think? Why do you think people suffer? Do you think that they see it internally as something that they should have to deal with themselves as other people have dealt with things? Because Alzheimer's and dementia are such difficult things to be burdened with individually. How would you advise someone to reach out and actually ask for that advice and help?
Right, that's really good, because I feel that's where the suffering begins, behind the closed doors, trying to do it all yourself. And so when you reach out and you find there's others like you, there's incredible programs and support out there, you realize you're not alone. Don't do it alone. And then you learn and educate yourself on how you can become a care partner and make it a walk along and not more of a new dance, if you will.
Right.
But more rewarding, more dignity. It will evolve, it'll be challenging, but you'll find some new gems in that process.
Yeah, Paul, how does Moneta programs really help people become better care partners?
Yeah, so about a third of the Moneta members who go through our program are accompanied by a care partner. And that's normally a spouse, but sometimes it's an adult child. And because Moneta is delivered virtually and completely over the telephone, what we often see is that care partner can join the therapy sessions, the rehab sessions with their therapist, dialing in from a different city, so that they are learning. And the three pieces of feedback that we've received is on the program from care partners. Number one, they learn about the journey of their loved one. What are those cognitive changes that they're going through? Number two, they learn how to take better care of their own brain health. And number three, as Kat was talking about, they realize that they're not going through this alone. And so there's the support. And there's research that reinforces this, that 50% of the a reduction in caregiver burden can come from a care partner going through a structured cognitive rehab program. So it helps the person with the cognitive challenges, and it helps the care partner.
Yeah. I mean, there's no real one-size-fits-all to all this, right? So, I mean, that's where Moneta comes in, with the experience, expertise, support, advice, and understanding of the different varieties of conditions.
Exactly, because it is not one-size-fits-all, and that's why the program has to be personalized. It's why a therapist leading this in a structured way. You know, we talk about what Moneta is. It's different than a brain game because you have that clinical support and guidance, but it's also very engaging, and that's where the individuals and their partners can start to walk side by side and not feel like it's just such a burden on that caregiver.
That's great.
Well, thank
Yeah.
you both so
Thank
much
you.
for joining us this
you.
morning.
Thank you.
Yes, to learn more about Moneta Health and their mission to support cognitive rehabilitation, visit monetatv.com.